So, in today's radiology class, we are going to discuss about USG. So, very important topic about USG. So, let's discuss about what is USG machine, okay, and how it works, okay. And second thing is that how many types of props are there, okay, and different types of ultrasonography. So, let's discuss all those things. So first is machine, ultrasonography machine, USG. USG stands for ultrasonography. This is the full form of ultrasonography. So let's see the image of the machine. So you can see that this is the ultrasonography. So you have here screen, okay, and you have this some setups, settings, and you have this probes, okay, different types of props are there, and this is the uh, uh, processing unit. So with the help of probe, the processing unit will display the inner images of our body. Okay, so this is the ultrasonography machine. Okay, this is the ultrasonography machine. So how the sonography machine works? Very interesting, but I will tell you in the short manner. So basically, here we have props, different types of props. You can see this. This is the different types of props. Okay, this prop will produce some waves. What it will be? Produce the waves. What we will call this as piezoelectric effect. What we will call piezoelectric effect. So it will contact with the organs of the body, and it produce some waves, electricity into the waves. Okay, the piezoelectricity is converted into sound waves. Okay, and the waves will take the detailing structure of the internal organ, and again the sound waves convert into electricity. From the electricity, the probe will catch that waves and it will display in this picture. Okay, it will display in this picture. Okay, so this is the props. Okay, props have piezoelectricity. Okay, and it will generate the sound waves, and it will take the structure of internal organs, and again the sound waves convert into electricity, and the probe will catch that electricity. And what who are doing, who are the processing units. Okay, and the processing unit will display the image of internal organs. This is how ultrasonography work. Okay, so the probe having the ability to piezoelectricity, what we will call piezoelectricity into sound waves, and vice versa. Sound waves into piezoelectricity into sound waves. Okay. Next thing is that we have different terminology in the ultrasonography. That is, when you see the image, okay, you will get one type of, let's see the one, the sonography, like, yeah, you will get some paper like this. I think all are seen this with the ultrasonography, along with you give a picture, okay, digital, like this. Okay, in that you have some appearance. Okay, some appearance are there. So we have three types of appearance already in the impressions. Also, doctor radiologist will write that is called appearance. What appearance will stand? That is nothing but terminology. We have bright, we have gray. If bright color occurs, what does it means? We have to remember this. And last is black. Gray, bright color terminology is hyper echoic, and gray color is hypoechoic, and black is anechoic. Okay, so these are the terminologies we'll use for the color terminology. Okay, what does it means? If there is hyper echoic, means bright color, means they have possibilities of three things. One, it may be calculi or air or shadow, or here third one is bone also, means calcification. So if you are getting white color, bright color image, and as well as they are written in the USG report hyper echoic, means there is calculi or air is present. Okay, we have to remember. Next, we have gray color. Gray color are mostly uh, very rare. Okay, we have black color. Black color appears in the, we can see gallbladder, because in the gallbladder we have fluid, that is bile. Due to that bile, we will get the black color. And urinary bladder, we have urine. And cyst, mostly hemorrhagic cyst, that will appeal anechoic. So these are the terminologies we have to remember. Now come to the different types of props. So we'll see this image. Okay. So according to the condition, the doctor will utilize these types of props. So in that we have most important is linear. This is very important. Linear, linear is frequency. It will get into uh, deeper, and you can see in from the linear arteries, veins, skin, musculoskeletal, testicles, eyes, breast. Okay, all these are done by linear probe. Okay, next we have this is the second curvilinear. Okay, convex we will call. It is mostly used for gallbladder, kidney, liver, uterus, ovary, aorta. Okay, so gall means some organs, internal organs related. Next, we have uh, another type of, mostly this is microconvex or phase arrays. Phase arrays. Phase arrays are used for heart, lungs, pleura, abdomen. Okay, so mostly utilized probes are linear, phase arrays, and convex. And another type of probe, that is transvaginal. So you can see that this is the long type of probe. Mostly it is utilized to see the internal structure of female, okay, like uterus, ovaries, uh, fallopian tube. Okay, so that's the reason we'll call transvaginal. Okay, so this is mostly used in any infection in the uterus or during pregnancy. Okay, so all these are measured with the help of transvaginal. So this is the prop like that. Next thing, different types of we have different types of radiology. Okay, USG radiology. And one type of probe you will get, but I didn't got the image. We will call this EUSG uh, elastography. So we'll discuss. So this is different types of USGs. So how many types of USG are there? So in that you have 2D. Okay, okay, we have 2D echo. We'll call it is also a type of USG only. So we measure with heart. We select the heart. Okay. So, but the different is probe only. That is ultrasonography only itself. Okay. And we have another type of USG, that is endoscopy. Endoscopy means to measure, to see the internal structure of esophagus, lung, and as well as stomach, small intestine. And we have colonoscopy, bronchoscopy. All these are the form of USG itself. So we see the internal organs, like in the colonoscopy, you can see the large intestine mostly and small intestine. In endoscopy, upper abdomen, esophagus, okay, esophagus, stomach, spleen, pancreas. So any uh, ulcer, anything related things you can see. In the colonoscopy, large intestine. Bronchoscopy, structure of lungs, bronchus, bronchioles, trachea, etc. to be seen. Next type of USG, that is called elastography. USG, elastography. It is to see the stiffness of an organ. Stiffness an organ means like any organ have, like example, tumor, cyst. Okay. So how much amount it's spreaded and what affected, how much amount is affected to the organ. Okay, mostly it is also called liver scan also, or you have another name, that is fibroscan also. Mostly it is used for liver cirrhosis. Liver cirrhosis. Okay, so those are the different types of USG, and we have another type of USG. Two types of USG very recently. Recently means not recently, but it's appear, that is one is 3D USG. 3D USG is mostly to see the various structure of the in a colorful manner. Various structure of mostly obstetric imaging. Mostly obstetric imaging. Okay, various structure of obstetric imaging. So 3D mostly used for uh, pregnant women. Okay, to the structure of cranial bones, or spine, or any related problems like heart. Our structures are confirmed or not. Heart is fully developed or not. Okay, so this can be seen in 3D USG. So we have fibroscan. Another type of scan now, that is we have that USG contrast. USG contrast. So this is n- recently developed. We'll call CEUS. What we will call? We'll call CEUS. Okay. So in that, what happened? Small amount of air, air injected through the intravenous, and it will go to the body vessels, and it eliminate from the lungs. Like if in the MRI IV contrast, if you inject any substance, if it is uh, related to the IV contrast, it will eliminate from the kidney through the urine. But if the kidney are damaged and it is nephrotoxic, the kidney are damaged, so you are not able to do the IV contrast. Okay, but in the USG contracts, you can able to give this contrast. Okay, and it is eliminate with the help of lungs itself. So in that, some small IV injections will give the produce the air waves are there, so it will enter into the affected area and eliminate from the body. Okay, so why it will do will this is to see the perfuse the organ, perfuse of the organ. Okay, perfuse of the organ. So this is the ultrasonography, about ultrasonography. So we saw different things related ultrasonography, how it works. Okay, and machine, how it works we discussed, and appearance terminology. Okay, and types of USG. Okay, different types of props, when to where to use, discussed. Okay, so this is all about USG. So the basics things related radiology is completed, like CT scan, MRI, how it functions, what types of different methods or appearance, etc., etc. Now we'll from Monday onwards we'll discuss uh, related system related radiology. Okay, so first we will start with gastrointestinal radiology. Okay, so if anyone have any doubts, kindly ask.